got a ton of questions about this, so let's talk. A death doula sometimes is called an end-of-life doula or a death midwife. So if you know what a doula or a midwife is, you might see where I'm going with this. Doulas and midwives are basically companions. They're people whose job is to help other people through transitions. Generally, these transitions include pregnancy, birth, postpartum, and death. Now, what all of these situations have in common is that there is a need, oftentimes, for medical observation, sometimes even intervention, and they're also very emotionally confronting, sometimes psychologically or spiritually confronting. And in allopathic or Western medicine, we don't really take care of the entire person. A lot of the time in these transitional periods, a person might have the assistance of their loved ones, and those loved ones are also going through their own transitional period in that time, or the support of medical professionals who are wonderful, but they also have a job to do and other patients to take care of. And they typically aren't there for the entire duration of things. They just kind of check in to see progress and vitals. So doulas and midwives often come at this from the perspective of complementary or holistic health. Holistic health literally means whole person health. So they're not going to be giving you medications or checking your vitals or doing anything like that, because that's usually already covered. They're going to be there with a person and with their support system one-on-one, making sure everybody understands the processes that are going on, making sure that everybody is able to contribute in some way, basically helping with the psychological and the mental and the spiritual side of things. And they might also offer methods to help with the physical side of things too. Think like massage or changing body positions so things are more comfortable, things like that. They might also do breathing techniques or guided meditations, and oftentimes they'll help to make an environment more relaxing for somebody, whatever person's wants and needs are. So if you think about this in terms of pregnancy, birth, postpartum, it usually ties into a birth plan. People fall pregnant and then they expect that things will progress and that they will eventually give birth, so they begin planning for that, right? Now, looking at this from the perspective of death or end of life, there are some situations in which we can predict that too. And just like how it's important to have a birth plan, research into where you want to go, who you're going to have with you, what kind of methods do you think you're going to try to, make this an easier transition for you. It's important to have death plans too. I'm going to say it's more important to have those plans in place while you are still young and healthy and able to really think about all of this stuff before you're actually confronted with it. It's never too early to start a death plan. Make talking about death normal. It's a lot less scary that way.